Thank you. And with the audience, if we can please take our seats. Thank you. So our next discussion is focused on public-private partnerships in terms of maternal, newborn, and child health and non-communicable diseases. We've been having a lot of discussions on both the role of the private sector over the next 10 years, but also PPPs. PPPs is a concept that has been evolving and is now in a lot of the WHA discussions. And so I think with the expertise of the panelists here, we'd really like to flush out, key components of public-private partnerships in maternal, newborn, and child health that will help us create sustainable health over the next 5 years. So with that, I'd like to turn to our first speaker, Dr. Scott Ratson. He wears many different hats, and so I'll let you introduce yourself as is typical for our live stream audience. But one of the things is that I posed to each of the speakers, but particularly you, to Scott, in many of the different positions that you've had, from co-chairing the Innovation Technology Task Force to, the Health Communications Journal, how do you see PPPs specifically for non-communicable diseases evolving over the next 5 years?
Thank you, Joanne, and I appreciate the opportunity to speak amongst these great panelists and would like to first introduce myself. I'm Scott Ratson. I'm a public health physician, and I currently work as Vice President of Global Corporate Affairs at AB InBev. And my other roles, which I like to mention because they're listed on the program that I'm not speaking on behalf of, I'm on the Board of Scientific Counselors for the United States Centers for Disease Control and Prevention in the Office of Infectious Disease, as well as edit the Journal of Health Communication and Global Health Communication. I've been quite enthralled and interested, but with the last panel, both ambassadors and the global health community has spoken about in the audience here on what's happened with Ebola, and I think without a doubt there are lessons to be learned. But notwithstanding that, the special envoy from UNAIDS, it was excellent to hear the need to have lessons learned from HIV/AIDS over the last few decades and how we shouldn't forget and have, whether it be compassion, fatigue, or complacency, in lessons from infectious diseases that we apply it to reproductive, maternal, newborn children health. So the panel today, as Joanne mentioned, I used to co-chair the United Nations Innovation Working Group on Women and Children's Health, and it was a public-private partnership by design from the UN Secretary General's office. And after I stepped down, I was with the Johnson & Johnson and Norway with Tora Goodall. Peter Singer, who's in the audience of Grand Challenges Canada, has stepped up, as well as a representative from GSK, to take this forward to the next level and continue to advance many of the ideas, because innovation, by definition, does not reach the 95% certainty that we might like for the laboratory. And one thing that I think is most particular about what we've discussed here today is the need for health diplomacy. And in the Innovation Working Group, we had written a green paper on health diplomacy, which is not only amongst the title of the sponsor here today, but talks about bringing multi-sector groups together to have who have different perspectives, different backgrounds, different networks, and figuring out ways to synergistically develop answers to the challenging global health problems that we have today. I would say that over the course of certainly the last decade, health diplomacy has gained originally a concept not germinating necessarily out of Geneva, but out of Northern Europe, and had made its way as the Global Health Initiative at the U.S. State Department changed to global health diplomacy. With that, I'll give a few examples of public-private partnerships, and I know many of the other private sector folks who have been in both public and private sector. Myself, I was at USAID, and I know another member here was at WHO. We've been able to try to bridge some of the unique ways of looking at the public health challenges and global health security issues that we just talked about. So let me first mention something that fits in the Sustainable Development Goals and surprises many people. If you looked at the Adolescent Health Report last year, you might recall what the #1 cause of death was for adolescents around the world. And it usually doesn't pop up in people's mind, but it's road traffic crashes. And we call them accidents, but many people around the world say they're not accidents. Accidents are things that you can prevent. So road traffic crashes are the 8th leading cause of death worldwide, 500 children a day, 3,000 people a day, 1.3 million deaths a year, the number 8 over leading cause of death. So we looked at a new way of a public-private partnership, but started with the private sector only, of looking at a way to address road traffic crashes. And ourselves, AB InBev, IBM, AT&T, AIG, Chevron, Walmart, Facebook, iHeartMedia, and others have got together to say, how can we raise this issue that it's not just on an SDG list of a number of indicators, but something that we can do something about and bend the curve. So that's a new example, and I just mention it here as it's just forming. If others are interested, I'd be certainly happy to talk more. It's called togetherforsaferroads.org, and it was launched at the United Nations with the Assistant Secretary General, Amina Mohammed, and U.S. Secretary of Transportation, Belgian Ambassador, and 11 CEOs. So lots of activities are going on there. But this builds upon work that I think we've learned the most in the women and children's health area. Notwithstanding, you'll hear some activities here today. But let me just mention, a few others that I think have shown that we can use and leverage new technologies and figure out new technologies, not just at the point of care and delivery, but also in the prevention end. So how do you get women who are pregnant, who might not necessarily have even a physician, caregiver, midwife, or anybody in between, health information? And I have this one piece which I used to say, well, it's two things, right? This is now called a smartphone, and even the simple phones, some people call them dumb phones, which I find kind of interesting. But the original phone, you can send text messages and give women information throughout pregnancy, and something that the U.S. Started was called Text for Baby, and it was also evolved into a mobile alliance for maternal action with the U.S. State Department, USAID, and a variety of other partners to come up with ways that we can deliver messages and give information in a health literate manner. So if you can't read a text message, you can listen to it. You can listen to it in a local language. You can pass it along. You can use now new software, obviously, to bring people to the right point of care, to remind them of immunizations and some of the lower cost activities. Once you have this delivery device in health communication and community workers, as somebody mentioned earlier, we have the health ecosystem more in place to deliver information, to deliver teaching methodologies, and also to figure out ways for those of you in the health system area for both supply chain and other items that make a big difference. There's a variety of other ones I could go into today. Some of them work more at the workforce level. So how do we get workers educated in non-communicable diseases in obvious places in the family area? But I don't think we have necessarily time for that today. The other piece I would just mention, though, is that as the world is moving forward, and this is health within arm's reach of every individual, it also could be a hazard, which we have found, unfortunately, as I mentioned, road safety, with what we call distracted driving. So we have to think about the unintended consequences of having over-reliance on some technologies in some cases, or not figuring how this all relates into the whole health ecosystem, as mentioned earlier. So let me end with, I think the challenge to all of us in this private sector world and multi-stakeholder world is that when we think about diplomacy, most people here in Geneva or these global organizations think about diplomacy as something that is done by state actors. It began by the French in the 17th century and schools of diplomacy. But as we look today, diplomacy is becoming more engaged with multi-sectors. Healthcare in many countries is delivered more by the private sector than by the public sector. The growth and opportunities with the private sector to come up with innovation and speed up or leapfrog with the technology space and healthcare delivery space has evolved. So our hope is that health diplomacy has the private sector at the table, civil society at the table, other NGOs and non-state actors, voluntary organizations, donors that could be on all different levels, as well as the sustainable arms of government, academia, and civil society. So in the end, I think the challenge to all of us, whether we're working in the scientific end, the private sector, or all of you who are listening around the world, how do we scale those activities and how do we communicate them? So that's where I'll just end. We're creating this new Journal of Global Health Communication with the idea, just as we learned from the Ebola challenge, that communication was one of the major issues that we could have done better. We've learned the same from SARS, we've learned the same from swine, we've learned the same from a lot of infectious disease, and now we need communication for non-communicable disease. So thank you very much for the opportunity, and I know we'll hear some better and interesting innovations at all different levels, and want to challenge all of you to continue on this path for better global health. Thank you.
Thank you so much, Scott. And I think one of the things that I've found fascinating just over the past year, we've been convening the private sector with the Government of Canada on maternal, newborn, and child health, successful PPPs, is the amount of actual successful implemented PPPs in this area that exists. So I think, Scott, that the comment of the private sector and how, it's becoming the future of really how we're doing global health. We begin to really need the PPPs on the ground. And with that, I'd like to turn our conversation to our representative from GAIN, because GAIN has done a lot of successful, PPPs in this area of nutrition, and you can exemplify how to do it on the ground. So if you could please introduce yourself to the live stream audience.
Sure. Good morning. Thanks very much for the invitation to be a part of this panel. I come from the world of nutrition. So moving a little bit away from the health discussions that we've had so far, I've spent most of my professional career in Latin America, working with particularly the government of Mexico on using evidence to improve the design and implementation of programs directed particularly towards women and children and focused on the poor. And I want to start a little bit with talking about the region of Latin America and then transition from that. And the reason specifically is because many countries in Latin America have made huge progress to improving child growth. We've seen dramatic reductions in the prevalence of stunting in Chile, in Mexico, in Guatemala, not in Guatemala, that's the exception, sorry, in Brazil. And much of those have been done with very interesting approaches. A lot of it has to do with very, very effective, focused targeting on the poor by linking social protection and nutrition and health interventions, very strongly in Brazil and very strongly in Mexico particularly. There's also been an incredible increase in economic status of those countries, as you know, and that's where part of the challenge comes in. At the cost of those improvements in child growth and health generally, has come enormous and frightening increases in the prevalence of overweight and obesity and all of the related potential chronic diseases and manifestations of those problems that we've seen. And that's where I think we have an incredible opportunity and challenge of working with public and private partnerships. Unless you focus the interventions and really thoughtfully and cautiously manage what's happening in the face of economic development, you will have the same problem in other countries around the world that has happened in Latin America. You improve health, you improve child growth, and all of those opportunities that those generate, but we're starting to see it in Nigeria, in India, and in countries around the world where economic status is improving. We are also seeing incredible increases in the prevalence and the early onset of obesity, and we know that that has long-term consequences across. So I want to talk about opportunities in public-private partnerships to address some of those challenges. And they really revolve around three ways of working. One is dialogue, the other is incentive, and the other is innovation. Let's start first with dialogue. And I'm going to go back to Latin America there in my world pre-GAIN. In Latin America, for decades, there's been a milk distribution program that reaches very, very effectively targeted towards the poor segments of the population. Whole milk distributed to children, where we're starting to see a prevalence of 30% overweight and obesity in young children. So what happened in that dialogue, that a lot of that milk is managed and is collected by a government supported industry, but it is a private company, private sector company. That is, the milk is consolidated and it's processed and then it's packaged for distribution through this government program. And what we did in the process of that dialogue was to, number one, get that milk fortified, because those same children who are receiving this free milk have a prevalence of 45% zinc deficiency, a prevalence of 40 to 50% anemia, and 30 to 40% iron deficiency, among many other deficiencies. They're drinking the milk. If we fortify the milk, we can address those challenges. But at the same time, why are we giving them whole milk if there doesn't appear to be any lack of calories in the diets of these children? So we also worked with that company to make that a low-fat milk. It's a small intervention. It's one piece of a very complex puzzle, but it's an approach in the right direction, and it's a very clear example of how a public-private partnership and working together can have a very important impact. And there's many studies published on showing the positive impact of that program on micronutrient status of the children. I'd be happy to share some of those references. Now I'm going to move. I've been at GAIN for 1.5 years, so I'm still new to the world of GAIN, but I want to talk about two very specific examples related to the incentives and related to innovations. So in the side of incentives, we also know that in a lot of places, it was a big shock for me. I had spent 25 years working in Latin America, and when I left that world to work in Africa and Asia, it was quite an eye-opening experience to see, number one, the extent to which the accessibility and the affordability of foods was just an enormous challenge, that it is not a challenge in Latin America. It is an enormous challenge in many places still, as are the health systems and the strength and the points of contact that you can actually deliver interventions through. In Côte d'Ivoire, GAIN has been working on a public-private partnership for approximately 5 years with a local food company, with HKI, and GAIN itself, to develop a very high-quality fortified complementary food for children 6 to 24 months of age that is specifically targeted to reach the bottom of the pyramid. So it is up to international standards, marketed in agreement with the International Code of Marketing Such Foods, but at a cost that lower-income families can actually afford. At the same time, so that's the private sector component. The public sector component is working with HKI to ensure that that product is used appropriately in an adequate, comprehensive approach to infant and young child feeding, which includes early breastfeeding, exclusive breastfeeding, and then the introduction of appropriate foods at the moment that it should be done, which is at 6 months of age. And then on GAIN's side, a lot of technical support for the product itself, and also evaluation, process and impact evaluation, which we managed over the past 5 years, or the past year, but we've done the evaluation. And we've now seen incredibly high uptake and utilization of that product, and increases and improvements in the knowledge and understanding of appropriate infant and young child feeding in that context. So that's the incentivization. One of the ways of working with business is to incentivize them to invest in better products and encourage them to work on products that are specifically focused on addressing dietary gaps that we know exist in the country. And innovation, I would like to speak about two examples. One in Bangladesh, where again, we know that there is a very important challenges of reaching the poorest through the public systems and through products that might help fill some of the dietary gaps in nutrients. But yet there's the largest NGO in the world working in BRAC that reaches almost every corner of the country. So what we did with BRAC and are continuing to work now in a second large scale-up phase is to use the BRAC network of what they call Shastashavikas, which are local women who started out with, as a wash program, selling very low-cost soap. They reach every corner of that country. They have now included a nutritious product. It's what we call a home fortificant, micronutrient powders. It's a very small amount of powder that you can add to whatever food that child is going to consume, and it's like giving a nutritional supplement, but the child, there's no adverse reactions, there's no flavor, there's no texture, and so you fortify that food in that small quantity that individual child can consume. So now, as a part of those products that the Shastashavikas carry and distribute to or sell at very low cost to the population, includes micronutrient powders, and they have been trained again to work with the women to promote adequate breast and complementary feedings and to understand how this product might be the part of an appropriate approach to infant and young child feeding. So again, that's a partnership with the local producer of those products, BRAC through the distribution system, and GAIN is working on the evaluation and the management of that. And finally, I'd like to speak very quickly about trying to find additional ways of getting both incentive and innovation into the private sector around the quality of food. Again, both in terms of the accessibility and the affordability of high quality foods, but also changing the dynamic where we don't see so much as income increases, such an explosion of as what we call in the nutrition community, empty foods, empty calories, high-dense, energy-dense foods that really have no nutritional value. Let's work with the private sector and motivate them and incentivize them to find nutritional products that have an economic value for them, but also are feeding the population. And in a way of doing that, GAIN has developed the Business Partnership for Nutrition Research, and we are working with the Canadian government in this case and a group of businesses to try to identify evidence gaps and barriers for businesses to make those kinds of investments in nutritious products at low cost, and then fill those gaps, do that research that will motivate them to then make the investment and to develop the products that would be available for the market. Thanks.
Thank you so much. And with our last two speakers, I really like to turn to the practical innovations that both, Rita from a GE perspective and Mario from a BD perspective have been doing, and how quickly they've made a change, both for me very personally from a maternal health perspective, both the Audon device from BD and for GE, the scanner that you've basically revolutionized and turned into something that can be used on the ground. Being a mother of 3 boys and having had, obstructed labor and having had 3 C-sections, these technologies, if I had not been, in the developed world, I would have needed these technologies in one way or another. So from a very practical perspective, we really need to get these conversations going, and we need to scale up these projects so that we can have them delivered to the women that need them. If I had been born in one of these countries that didn't have access to good health care, I would not be here. So thank you. I'd like to start with you, Rita, please.
Good morning. First, thank you for the opportunity to speak on the panel. It is indeed an honor. My name is Rita Barksdale. I am the leader for our maternal infant care business. And as we look at technology, it's important that we create technologies that can meet the clinician and the patient where they are. And so 2 examples of that are our vScan Access product, which is the second generation of our vScan product that we've been able to use with midwives within countries such as Tanzania to prove that they can be used in order to evaluate women during pregnancy and to identify those that are going to need more elaborate care so that they can make that journey to the right center in the time that it takes to get there. To Joanne's point, if you are delivering in a Western environment, oftentimes you need a lot less time to get to a hospital. But if you're in a situation where the access to health care is further away from your home, and you're going to be traveling over a difficult process to get there, and it's going to incorporate a elaboration of walking and buses and things of that nature to get there, you need to know sooner than later that that journey is necessary. And so by being able to use a device that is much easier to operate, much easier to understand, and midwives can be trained, and it's portable to allow them to take it to the home of the mother, they can get that understanding, they can get that information and get to the right location and be able to save lives. And we have seen a reduction in maternal mortality because of this device, so it's an exciting thing for us. The second innovation I would talk to is a device where we went into the primary care centers throughout India and also into locations in Africa. and did some studies and understood what product was necessary to help those children that were not able to use kangaroo care for several reasons, but still needed the warmth that was necessary to help a child in those very first days of life to be able to continue to the process of life for them. So with a newborn baby, if they are born prematurely, then their energy needs to be used to continue to develop their organs versus trying to warm their bodies. And that's what this warming device does for them. And when we were doing these studies, what came very clear to us is that there are three main components that are necessary in this type of device. One, it must be extremely easy to use, because oftentimes the clinicians do not have the elaborate training that they would like to have at that stage. So it has to be a device that can be extremely easy to use. It has to be rugged and reliable. So it has to be something that, one, doesn't break. So we reduce the number of moving parts, we reduce the number of consumables, we reduce the level of tooling that's necessary to implement the device. And we've also made it a rugged device that can handle the fluctuations of power, that uses a lot less energy so that if a generator is used, it is not a burden on the system. Things that are necessary you need to think through for a product in this environment. And then the last thing is cost. It has to be low cost to purchase, but it also has to be low cost for ownership over the long term of the device to allow for the funds to be used for other devices that are necessary in this environment. And so we developed what we call our Lullaby Warmer Prime. But the last thing is it has to provide the same level of care to the baby. Because regardless to the situation in which a baby is born, it still needs to be heated to approximately 36 degrees. So it needs that same uniformity, and that was the main thing as our engineers are developing new products for these different environments, is that the clinical piece is the same, and so therefore the baby can't know the difference depending on which warmer that it's in, and we've been able to do that. And then the second piece to that, though, is working with the public sector to understand the continuum of care. Just as you look at a system and it has a primary health center all the way to a reference hospital, and the clinicians are different throughout that continuum, the patient need is different throughout that continuum, we also have to have products that are different throughout that continuum. And that's what the private sector has to be able to do, and then educate on what those differences are, when to use certain products, and when what type of training is necessary, and have that as a bundled approach. Because it's so key as I walk through and visit with different NICUs across the world, it's disheartening when you see reports from WHO that donate equipment or even sometimes purchase equipment 70% of the time is not being used because it's not the right equipment for the right environment. So public and private have to come together and have an understanding of that to make sure that right equipment is used. Sometimes I hear that, but I want the best equipment. And I understand that. But the best equipment is the equipment that's going to be used in that environment to save lives. That's what we've got to get to, an understanding of what best means. Because if you have equipment that can't be used, it's great that it's a high-spec product, but if it's not saving the lives in that primary health center, it's not the best equipment for that location. And together we need to come to understandings of how to determine what that best equipment is, so that the goal that we all have, which is to save lives, is what we accomplish. Thank you.
Thank you so much. I'm going to turn it over to Mario, and then I'd like to turn it over to our audience to ask questions of our experts on the panel, because I think that's what you really want to do, is be able to ask them questions. And also to our live stream audience, if you can submit questions via online, that would be great. Hopefully we can answer one or two, depending on timing.
Thank you, Joanne, for giving me the opportunity to participate in this very interesting discussion. As an introduction, I would like to say my name is Mario Merialdi. I'm working at Becton Dickinson, a company of medical devices in the area of global health. And before joining the company, I've been working for 13 years at the World Health Organization, where I was coordinating the research program in reproductive health. The Odon device that Joanne mentioned, it's a new device for assisted vaginal birth, which is relevant for both developed and developing countries, and has the potential to increase access to appropriate intrapartum care, especially for women in low-resource settings. Now, what is particularly interesting for the discussion today is the way in which this device is developed and eventually will be brought up to scale contingent upon the result of ongoing clinical study. Because this way, it's a very concrete and I would say successful so far example of private-public partnership, which involves the company, BD, involves WHO, involves Saving Life at Birth, which is the initiative that provided funding to start the project, and other organizations. And I'm in the quite unusual, but I would say privileged situation that I can provide you briefly with a perspective on this partnership from both sides. The public sector, when I was working at WHO, and the private sector, my present role now in BD in the company. When I first saw this device, it was in 2008 during a trip to the hometown, Buenos Aires in Argentina, of the inventor. And I came back to WHO, to the department, with this idea. We gave thought to it. We put together a group of international experts, and we decided that we really wanted to do a study to test the safety and feasibility of the device. But then we quickly realized that the story would have ended there. We would have published a study, we would have done very interesting academic exercise, but then we would have found ourselves in the situation, unfortunately very familiar with many of us working in the maternal and the newborn health field, in which we have a potentially safe and effective technology which will never be implemented because there was no business plan behind it. So we started to look actively for a company that was willing to collaborate with WHO on the development of this device. Also because, think about it, conducting studies in women and exposing them to the potential risk of a new device with no vision for a global distribution of the device would have been unethical. And we found this company in Becton Dickinson, which actually liked the project because it gave the company the opportunity to invest in a shared value approach. That means that you develop a product which addresses an important unmet need. So you develop you create social value. And you do this in a way which is financially sustainable. So it's not really philanthropy, it's not corporate social responsibility, it's really a way to do business in a way that you can create social value. And the story doesn't end here, because this will be for the development and manufacturing of the device. But if you really want this device to get to the people who need most, and you highlighted this point, which is, I think, the most important point of the story, you really need to extend this collaboration to other partners. You need the healthcare professionals, the doctors, the midwives, and their professional association. You need the international cooperation agencies that will procure the device. And you need the NGOs, which will be able to actually bring this device where it's most needed. And this is actually the business plan which has been put in place. It's a collaborative business plan. And I think it's the secret that has allowed this innovation, which, and I kept this for the end because it's probably the most interesting aspect of the story, that the inventor was a car mechanic from Buenos Aires in Argentina. And this invention was able to travel all the way from his garage to where it is now, through a pathway which is very difficult. We know how many innovations there are around. We know how many of them stops along the way. There are many places, many problems, many challenges that you face. So far, this innovation has progressed, and I think the secret is the collaboration among different stakeholders.
Thank you so much. And I'd like you to turn it now to the audience. If you can please raise your hand with questions. Kate? Oh, there's a question in the back, and then we'll turn it over to Kate.
Hi, yes, my name is Katie, and I'm from This Week in Global Health, or TWIG. I just had a question for those that spoke about innovation and technology and these devices. I know that oftentimes we think about the device being in the situation and make sure that it's usable and distributable and everything. What kind of training or support would you give to the device for repairing it? I know that's a big problem in technology and global health.
I'm sorry, if you could just add the last pieces for preparing it.
Sorry, for repairing it. Repairing. So when it breaks down,
Okay,
what
thank
kind
you.
of support do you give to it?
Okay, thank you. One thing we look at is two things. First, in the design. So making sure you have as little pieces that could break as possible. That's the first thing you got to take a look at. As I mentioned, in some warmers you'll have 10, 15, 20 different moving parts. And the one that we developed for this environment, it has 4 moving parts. And those moving parts do not require any elaborate mechanisms for repair. So a screwdriver and you're good to go. So that's the first piece. The second piece, though, is the ecosystem in which it's going to be input into. So you've got to create an environment where you have a servicing area around it. Because it's not just repair, but as with a car that's going to need an oil change every 3 months, medical equipment also needs regular maintenance. So you want to make sure that regular maintenance is easy to do, but you also want to have that networking approach so that if anything additional is needed, they have support to do that. So it's upon the private sector to remember it's not just an equipment sale. It is a product that should be used for long-term of care to a patient. So you don't just put a product into the marketplace, you create that ecosystem even before you sell it. And that's something that's extremely important to us as we bring new product into the marketplace. And then the other thing is we do have lots of conversations with our customers around the training piece. We've provided a quick reference guide for this particular product so that it stays with the product at all times. Oftentimes an owner's manual gets lost, but if you have that quick reference guide that's attached to the unit, so that's with it at all times, it also makes it easier. You invest a lot of time and innovation into the user interface. We have a vScan access unit in the back, and I invite everyone to take a time to go back and spend some time with that unit. And what you'll find is that it's a touch screen. The icons are extremely easy to understand. There are a lot of pictures so that it can be used universally. Within the time it takes you to go take a look at it, I am fairly confident that our team can have you ready to do ultrasound looks before you walk out the door. That's what you have to take a look at. And as you're developing it, you make sure that you're continually innovating with clinicians who would be using it, coming in to test it. So making sure that it's easy for them to use and having that customer interface throughout the design of the product. So those are things that are necessary as you're bringing these products to market.
Wow. Paul? Sorry. Oh, sorry.
Thank you. Thank you very much. My name is Pap Guy. I'm with IntraHealth International. It is very clear with this WHA this year that we have entered a new era in public-private partnership. I was sitting at a table with a colleague yesterday from the private sector, and he said, I used to keep my head very low and almost hide when I come to WHA because we knew the private sector always had the bad rap and a lot of suspicion from WHO, from the institution. There's just kind of resistance. And I think the train has left the station. It's very clear that we are all embracing the fact that we're in a new era and we need to work together and so forth. My question to the panel is just any thought, any ideas you have about how we can really accelerate the process and get to a stage where we know what we're doing. Because I think, to be fair, we're all in a learning process. It's a new thing for all of us. The private sector will tell you, I know there are opportunities, but I really don't know the world of the NGO, and vice versa. There's still a little bit of lingering suspicion about, is this all about just markets? So I think the more we are transparent about our intention and what we're doing, the better we will be served, all of us. So my question to the panelists is, what advice do you have in terms of getting as quickly as possible to where the comfort level is what it needs to be for these partnerships to really strive and grow?
Scott?
Thanks. I'll answer that first, and I'm sure the other panelists will have other ideas. I've been involved with public-private partnerships, and similarly at a number of global institutions around the world, where oftentimes, yes, the private sector does not have the same, if I can say with civil society and other citizens of the world colleagues, the same ethos as we may expect in the world of global health, while we're all trying to do, hopefully, the same good thing to advance a better world. I've pointed people over the years to the Edelman Trust Barometer comes out each year, which talks about who are the most respected sources in different places of the world. And in some places it's business, in some places it's government, in some places it's media, and in some places it's civil society. And if you look in the North-South divide, many times it's government in the North and private sector in the South. And I've been looking at this for a number of years. Then you put the science community in, and the Gannett Foundation years ago did a report on Worlds Apart, science and journalists and the expectation of the citizens. And the difference is that there's different beliefs of who one can trust and who one would like to work with. And the default in many cases has been to the lowest common denominator. So it's a long way of saying if you look at the different audiences, it tests differently from the community level to the national level to the international and global level. And I think when we do the post-mortem of Ebola, and I'm talking about not just what we did on the panel here earlier, but when we really look at the different issues, we see who were the most trustworthy sources in delivering care, in answering the truth, if I can use the word truth, of what the transmission of the virus was, and the need to have local leaders, and the need to have religious leaders, and the need to have civil society, and the need to have global institutions that we could trust, we'll find that there's a challenge. So the short is I think what would be incumbent upon this community here, and what's important about this WHA, is what is the recipe for an effective public-private partnership? There have been people writing about this for years. What are the checklists? I think Mark Rosenberg's book on global health success, which is out of the Task Force of Global Health, has a lot of checklists of what you need. You need visionaries, you need people that can execute, you need people who can get the funding, you need people, all the different pieces that are in place. But there's a lot of other pieces. So I guess it's a long-winded answer to that. The more we can bring sectors together, and the more that we can demonstrate through effective ethical communication and publish what we do in a non-aggrandizing way of patting ourselves on the back, but having third parties account for it, show it, demonstrate it, and continue to have these discussions, I think the better off we'll be. I've seen a lot, in my career of the last 20 years, a huge change. And as I mentioned at the CDC board at the last meeting, when you thought about what's the role of the private sector, and this happened to be in the Ebola response, it was not just to have the private sector give money to the foundation. That's the wrong answer. The right answer is how the private sector can mobilize, and what are we learning from our medical officers at large employers? What are we learning from the people on the ground that are tracking what people are searching on mobile devices or whatever it might be? We have to use that clever nature of what we have from all ends. So I'm sorry it's long-winded. I'm sorry I need to leave, but I was trying to tackle what I think is the biggest promise we have, is bringing the synergies from the private sector and healthcare delivery continuum together. And I think the health diplomacy framework is a great one. I think there's a lot of other ways under the health security frame and so forth. And I applaud all the efforts. Thank you for bringing that up. I hope I don't continue to grow horns the longer I stay in the private sector.
Thank you. Did you want to address the same question?
Yeah, I wanted to address that from the world of nutrition, because nutrition is a funny animal. We have no home. If you look at nutrition schools, we sit in the School of Agriculture, typically. But if you look in ministries of health, it's usually the health department. It's usually the Ministry of Health. And what has happened over, I don't know exactly how, but the private sector has become demonized in the nutrition community. And to some extent, one can understand why. a lot of what we're trying to focus on is the result of the bad foods that people have consumed over the world. But on the other hand, how many of the population of the world are actually fully producing their own foods and not accessing foods via the private sector? That is dramatically and rapidly declining. If we don't dialogue with the private sector and we don't get over our demonization of the private sector, we're never going to advance in nutrition. And so to me, the first point and the critical point, and we've seen many examples of it working, is dialogue. If we don't embrace and discuss with the private sector, we're never going to move forward. But there also need to be some checks and balances, and there need to be the power of the government to be able to push back and say, for example, I'm going back to Mexico again. Mexico passed a law to get sweetened beverages, again, those empty calories, out of schools. Mexico has the evidence to say that of the top 10 contributors to the dietary energy intake, the calories that children consume in a day, sweetened beverages with no nutritional value are among the top. Get them out of the schools. And there you need to have, as well as the dialogue and looking for alternatives, you need to have some checks and balances. But it's not only about checks and balances. If we don't dialogue and we don't understand the challenges that we're facing and we don't educate and learn from each other, we're never going to move forward. So for the nutrition community, our first step is stop demonizing the private sector.
Thank you. Rita?
And the only thing I would add to that is during that dialogue, there needs to be transparency. All need to be open as to what their goals are. And then we also need to focus on a common goal, which is a better world. And I know that can seem overreaching and sort of ideological, but at the end of the day, if we're after global access to healthcare and we're after a reduction in the deaths of mothers and infants, then that's what we need to focus on and be transparent about it as we go through that process. And it's also understanding that in the private world, because of the need for efficiencies and so forth, there are some good things that we do. You know, on an earlier panel, I believe it was a representative from South Africa, noted that she looked at McDonald's and thought the way they franchise would be an outstanding way to look at our different clinics and how can we use a franchise model. That is something that can be done. You know, looking at the way, I believe it was Coca-Cola, was able to distribute little Coke bottles throughout the world. You can go anywhere in the world and get a little Coke bottle. Why can't we do the same thing with medicine? So looking at things that are done well in the private sector and how can that be utilized in the public sector through dialogue and transparency in that conversation, we can get there, but we have to be open to doing it.
Thank you so much. I see a question right there. Kate?
Thank you. I have a question about innovation, the location of innovation, and also how to incentivize innovation. One of the remarkable things about the Odon device story is that it was innovated by someone in a developing country, had nothing to do with that system or industry. And very interestingly, in the Ebola epidemic, the U.S. government had this Ebola Grand Challenges, particularly around improving PPE, and they were able to advance PPE technology in months, which would have taken years or wouldn't have happened at all if it had been sort of a single R&D unit in a single organization. So I'd like to hear the respondents talk about how do they incentivize innovation, particularly in the developing world or amongst non-traditional innovators, and what do they think perhaps can be done in the future to incentivize innovation?
Sure, I have a very concrete answer. I mean, there is a realization that this is important. There are more and more initiatives, and one thing that I've lived myself is this Saving Life at Birth initiative. That initiative is specifically targeted to identify and foster innovation, which actually is relevant for low-resource settings. And honestly, I have to say, the Odon device will not be where is it if it has not been for that specific mechanism that was actually intentionally targeting at risky innovation, very new things, but with great potential. So I think that what you brought up, it's a very important issue. There is this realization that innovation can come from everywhere, and we have to have the mechanism that actually enable us to capture these ideas as soon as they emerge, and then to transfer those ideas into actually concrete opportunities for everyone through the collaborative mechanism that we have been discussing.
And one of those non-traditional ways of doing it, we did something we call a hackathon. They're being done by different companies in different areas. But we did one in India related directly to maternal and infant care. And some very interesting ideas come out of that. What you have in a hackathon is basically anyone can come in with an idea that they want to investigate on any particular area, and in this case, again, it was maternal infant care. And it's by doing these non-traditional R&D activities that we're able to bubble up these ideas more quickly and opening it up to people who didn't necessarily come through the traditional, I'm an engineer and I've been doing this for a lifetime, so forth and so on, but I'm a car mechanic and I noticed that it's something and it reminded me of something else, and boom, I have an idea. And being private organizations are more and more open to that, and being able to take those ideas and seeing what can be done, particularly in areas where long development time, just you don't have that time anymore.
Thank you. I see a question in the back. Peter Singer, who's CEO of Grand Challenges Canada.
Thank you. And Grand Challenge is one of the proud partners in Saving Lives at Birth, along with USAID, Norway, UK, and Gates Foundation. So, Mario, congratulations to all the panelists. I just wanted to say in 60 seconds, because as Scott mentioned, I'm also co-chairing the Innovation Working Group for Every Woman, Every Child, what the strategic direction over the next 5 years of that is in the context of the Secretary General's global strategy on women, children, and adolescent health. So it really picks up from what Mario was saying, which is we now believe that there's a reasonable pipeline of innovation at proof of concept. We counted up more than 1,000 of them. And that still needs to be refreshed, of course, as you were just saying, but the real bottleneck is transition to scale. There are some good examples of things that are transitioning to scale, and we heard some of them, but the process is a little bit haphazard. So the real question is there a way to smooth that path? So that's going to be the problem that the Innovation Working Group focuses on to push things towards impact for women, children, and adolescents. How is it going to do that? Through the development of an innovation marketplace. What does that mean? It means a facility that makes it easier to see the things in the pipeline, to work on some IT platforms to do that and to analyze them, to curate the things on the pipeline. So of the 200 innovations in pneumonia, for example, you have some trustworthy way of saying, here's the 5 best, or here's the 10 best, or here's 5 or 10 that are worth looking at, to broker deals. So think about that almost as social impact investing, and to reach into new investor networks, in particular 2. You know, at the moment, foundations, governments, companies, NGOs are pretty well represented in the global health space. The 2 missing pieces are socially minded impact investors, family offices, and so on, to really help energize the finance at transition to scale, the pool of private capital that everyone says is always sitting on the sidelines because there's no easy channels to invest in innovations like what we're describing. And secondly, the links to the actual pull and demand from low and middle income countries themselves need to be firmed up a bit. So domestic governments, which ultimately are the largest investors in innovation. So that's just a little bit about where the Innovation Working Group is planning to focus, what it's planning to do. I think it's very consistent with the really outstanding examples that we heard about, and our metric of success, or our goal, and this will all be in the global strategy. It's in the technical background papers now that are available on the web through MNCH, is to essentially do 20 deals by 2020, thinking about a deal like the ODON device, with example of public-private partnership. And by 2030, which is the end point of the Sustainable Development Goals, to have 10 innovations that are really scaled and are really improving and saving the lives of women, children, and adolescents. Thinking of something along the lines of the meningitis vaccine in North Africa that has clear benefits in saving and improving lives. So just wanted to take a minute to kind of sketch where things are going, and hopefully if we're sitting on a panel in 2020, we'll have the same kind of examples but more of them, more systematic, with less pain to getting there, and significantly, they go more quickly. So that, I just wanted to provide that little bit of background. Thank you very much for the opportunity to do that.
Thank you, Peter. Grand Challenges Canada has done such exciting work and funded a lot of new projects. And thank you, Peter, for a lot of the work of Grand Challenges Canada. Any other questions?
My name is Ellen Eisman. I'm from Chemonics International. And it's been interesting to listen to this panel and other panels talking about getting the right combination of people working together in the public and private sector, doing the right thing, coming up with the right product, getting it to the right people at the right time, over time, cost-effective, et cetera, et cetera. I haven't heard very much, except in your comments from Gain, about the private sector's contribution to monitoring and evaluation, or monitoring process and impact, as you had mentioned. And the thing is, that's often an area that there's not a lot of money for. You get to the end of a project and they ask you about impact and how it went, et cetera, and there's not usually a lot of money left, and it's not often funded. I'm just wondering about, in all of this, with these great innovations and the success that's been had so far, what contributions could the private sector potentially make in adding that component to the work that's being done?
Let's take one more question, and then we'll answer both at the same time. Go ahead.
Thank you. It's very exciting to listen to the panel and to see how private sector is now looking at innovation and commodities and technology that is fit for purpose in developing countries, and also thinking about an ecosystem to maintain that. I want to respond to what Peter Singer has just talked about scaling those little initial initiatives, and also to call on not just the private sector, but domestic resources. How do we leverage domestic financing in going forward to actually support the scale and increase coverage of these technologies, not just within private sector outlets in developing countries, but also within public sector outlets in developing countries, so that it's not sitting somewhere. And then my one question, and it's really a clarification, and I might just be asking something that's totally unrelated to what you've all said, and I apologize. In our work in expanding domestic financing and in working with private sector in Nigeria, South Africa, and Kenya to actually look at domestic financing, we've heard things like, what's the shared value? And we've heard things like corporate social responsibility and private sector moving away from CSR to shared value. How does this affect the way you're promoting the products and the way domestic financing can link into what you're doing to expand access, or it has no relationship at all?
Thank you. Panelists who would like to take the... Okay.
Your comment is music to my ears, of course, being a person who focuses much of my work on monitoring and evaluation. And I want to link it back to the comment about innovation. We can have all the innovation we want, but it won't go anywhere if we don't know how, I think that you mentioned, how we're going to deliver that, and whether that is an effective delivery or not. And I think, just as you said that a company should envision a product development as an investment in or that sale as an investment in not only the sale, but in the maintenance, et cetera, of a product, the same way we should be thinking about innovation. We should be thinking, if we're going to innovate on a product, how would I deliver that product? And how will it actually fit within the systems that are existing? What is the delivery platform? What is the point of contact, et cetera? And it's innovating and ensuring scale up depends on having that vision up front, and then tracking and understanding what's actually happening while you're doing that through rigorous process evaluation, rigorous implementation research, rigorous evaluation. I can tell you in Mexico that that's what made the interventions that worked go to scale. They took the evidence from the evaluation to the government and they said, this is working. You cannot cancel these programs. You cannot. They're working on small scale, but if they're working on small scale, we can make them work at large scale. How the private sector comes in that, I think, the investment in monitoring and evaluation itself often has to come from domestic resources. It needs to come from donor resources. But there is a role for the private sector. There's a role in thinking about this innovation as an investment in its, not only its in development, but it's in its delivery, and ensuring that the resources are adequately taken into consideration across those many stages.
Thank you so much.
Well, the only thing I would add, I guess, in adding to that too, is part of it when we talk about transparency and the trust factor between public and private, I believe that evidence is necessary as we do these PPPs. One, to show what was accomplished, but also in the scalability aspect of how do you take this pilot? I would look at these at the beginning stages as pilots, and how do I take this pilot and the information from this pilot to show other governments, other public entities that this worked, and this is how it worked, and therefore it can work in your location as well, and that provides that scale component to be able to take what's done in one location and take it more globally.
Yeah, I would say exactly the same. When you have this partnership, there are so many stakeholders which are all needed, and each of them will need different pieces of evidence. So you really have to think from development of the product to adoption. And that's actually what we are forced to do, basically. And if you talk, for example, to doctors or professional association, midwives, they may be interested in safety and efficacy of the device. A government to implement this at national level would like to see impact on a larger scale, would like to see easiness of adoption. So it's very important, and it's something that definitely is taken care of. I think the effort that GE and BD, for what I've seen, are doing, are thinking broadly, not only at registering this device and getting a registration, but really get the kind of evidence that will assure that they will be adopted. For the shared value approach is definitely part philosophy for the company now, and this idea to move beyond the philanthropy and corporate social responsibility, which are still very important ways in which the company can do good, and try to move to shared value approach, I think shows that this idea of collaboration, it's actually going to a point where it becomes a theory in economics. And this shows the large interest that there is in share value. So I would definitely support everything which is done in this view, and I would say that for me, it's a very concrete opportunity.
Okay. Thank you. We're just going to take a short break to do rotation of panel. I encourage everyone to please not leave the room. The next panel will be on making emerging markets work for development. And so live stream audience viewers, we're only taking a 5-minute break. And for those in the audience, just please stay in the room. Thank you. As one of our next speakers also has to catch another plane at 10:30, so we will start right on time. Thanks.